number of measles cases in Alberta is continuing to cause concern as the province now has more confirmed cases than the entire United States. Joining us this morning is Dr. Lynora Saxinger, Infectious Disease Specialist with the University of Alberta. Good morning.
Good morning.
So the numbers are startling, but it's widely believed by experts that case counts are actually higher than the confirmed numbers reflect. Do you think we're actually dealing with more cases in the province than the numbers show?
I think that it's very highly likely that we are. I mean, in the highly affected areas, there's a lot of smaller communities. And although we know a lot of people are ill enough to present for medical care, not everyone gets ill enough to present for medical care. And so there's a high suspicion that especially in some kind of very, more insular communities, that there's a lot more cases than are coming forward for testing. And, colleagues who are working in these hospital sites really do think that there's more cases going on.
And it's summer camp season. Many kids will be out in large groups. Are you worried things could get worse, especially as the new school year gets going in just a little bit over a month?
I mean, absolutely. Our issue is that there are kind of networks and pockets of under-vaccinated, some very low rates of vaccination amongst school kids. And so it doesn't take much for introduction of measles into a group like that for measles to basically find all the susceptible kids. And that can just result in more forward spread. It takes a while for measles to show up, and people often have symptoms for at least a few days and are infectious before the characteristic rash appears. And so there can be a lot of spread. And so, all these gatherings, indoor type activities, and then school coming in with basically being almost all indoor is a pretty high risk scenario for seeing a lot more measles in school kids.
And are you hearing of any barriers families are facing when trying to get vaccinated?
Well, I guess there's a couple of things. There's been, in some zones, but not all of them, kids who are 6 to 12 months who usually would not get their first measles vaccine yet are being encouraged to be vaccinated. But the messaging is a little confusing because it's not everywhere. And I think it would be reasonable to make that available for all babies that age. It's like a pre-dose, and then they still need their 2 doses later. But that group is very highly vulnerable to severe measles. And so I think that would be reasonable given the patterns we're seeing. The other thing is that there haven't really been specific measles immunization clinics set up as far as I can tell. So people are working through the usual public health infrastructure. And so there might be some variability in how easy it is to go ahead and get that appointment, especially working through getting an appointment to say update your children if you inadvertently are behind or newly want to get them vaccinated because of the higher risk. And so I don't know how many appointments they're going to have available over the summer, and this is the time to do it before school starts.
Right, and going back to the numbers, are you surprised by how many cases we're seeing in our province?
Oh, it's absolutely shocking. For most of my life as an infectious diseases doctor for the last 2 decades, many years we've had less than 10 cases per year in all of Canada. And on average, like a high average would be 100 cases in a year. And so posting thousands in Canada, before the year is even over, is a massive, massive increase. And it really does suggest that it's going to be smoldering around in the communities for some time to come, unless something changes significantly.
And lastly, quickly, do you think the UCP government is doing enough when it comes to measles outbreaks?
Well, we just heard from the health minister, I think the other day, that there's been some targeted outreach and that they sounded like they were happy with the response so far. But I think we're still seeing pretty high numbers. And I know in other jurisdictions, when there's been measles outbreaks, even of hundreds of cases, it takes a tremendous amount of public health effort and very direct community outreach, and a lot of resources actually to bring measles under control. And I don't think I really am aware enough of the details of those to really be able to comment well, except I will say that we're still seeing quite a few cases.
Dr. Lynora Saxinger, Infectious Disease Specialist at the University of Alberta, thank you so much for your time this morning.
Thanks for having me.